Hello and welcome back to Chapter 9. We're picking up with reimbursement methodology on page 247. So, reimbursement is the act of compensating a person for services rendered. In the healthcare industry, medical providers treat patients before receiving payment. Fees may not be collected before the patient receives treatment because the necessary treatment is not yet known. There are many different reimbursement methods within healthcare. And the following sections are going to review the most common. First is fee-for-service. Fee-for-service is a reimbursement method that requests payment from each service or procedure. Each service or procedure has a set fee or charge. Providers are reimbursed only the allowed amount as listed on the third-party payer fee schedule. A fee schedule is a price list of services and procedures. Each payer has its own customized fee schedule. However, many healthcare providers base their fees on the CMS Medicare Physician Fee Schedule, the MPFS. Medicare uses the Resource Relative Value Scale, the RBRVS, to create the MPFS. The RBRVS sets fees for CPT and HCPCS codes. To calculate the value of the service or procedure, the RBRVS uses three factors. First, we have our RVU. This is your relative value unit. It's calculated for three components. The work RVU, which is the amount of work needed to render the treatment. The practice expense RVU, which is the expense to the practice to facilitate the treatment. And then the malpractice RVU, the risk of malpractice associated with the treatment. Number 2 is the geographic practice cost indices. These are adjustments applied to the RVU values to account for variations in the cost of practicing medicine in specific geographic regions. And then we have our conversion factor. It's the fiscal year monetary amount that is adjusted annually and is derived from the formula set by U.S. Congress to convert the GPCI into a dollar amount that reflects several elements. First is your category of service, whether it's medical, surgical, or non-surgical. The percentage of changes to the Medicare Economic Index, physician expenditures, access to health care, and quality of health care. And then you can see some examples of the national standard RVU calculation in Table 9.1 and Table 9.2. So you see here we have Los Angeles, California in Table 9.2 compared to Red Banks, Mississippi. We're looking at CPT code 49540. The work that goes into it is just almost, what is that? I'm not good at math. 1124 minus 1074 would be 50 cents. So we got 50 cents more for the work done in California than done in Mississippi. Expenses is not quite $2 more, $7.17 compared to $5.34. And then the malpractice is even higher in California. So the total RVU value in California is $20.69, whereas in Red Banks, Mississippi, it's $17.61. So you do have those different conversion factors in that graphic practice cost indices. Alright, so I'm going to let you kind of read through some of those examples over there of, again, it just kind of talks through that table of how it converts, things like that. So it takes that total RVU value there, and then it's going to use that conversion, and it shows that Los Angeles is $739.76, but in Mississippi it's $629.64. So kind of read through that so you get an understanding of how those conversion factors count in. We're going to pick up in the paragraph where it starts talking about the hospital charge master. So health insurance companies base their fees on the MPFS. Physician offices may also use the MPFS to establish a fixed fee schedule for the office, which lists all services and procedures offered at that practice. However, the fees set by the practice do not determine reimbursement amounts from third-party payers. Hospitals compile all procedures, services, supplies, and drugs that are billed to the insurance payers into a computer database called a charge master. Most hospital charge masters include several thousand line items that are reviewed and updated annually by a medical coder who has the title of charge master. Physician offices incorporate their most common procedures and diagnosis codes into the superbill. Posting payments, insurance appeals, and collections is the last step in the billing or revenue cycle. At this point in the revenue cycle, the focus is on making sure that healthcare organization receives the correct amount of reimbursement for the treatment and services rendered. When insurance companies do not pay correctly, healthcare organizations go through an appeals process to request additional payment from the insurance companies. When individuals owe the healthcare organizations monies and do not pay in a timely manner, the healthcare organizations initiate a formal collections process. Now we can get into our different practice management reports over on page 250. So frequent and routine monitoring of billing and collection reports is necessary to ensure the practice is receiving the correct monies owed. One such report is the billing and payment status report. This report lists the status of every patient account, allowing the billing staff to identify claims that need to be billed or rebilled, and insurance payers that need to be contacted regarding lack of payment. Payments from payers may come in the form of electronic funds transfer or a check, and the billing supervisor receives a remittance advice report that lists the patient's information and amount paid by Medicare and other payer to the physician practice. Now, let's talk about some different production reports. So the EHR system is able to generate valuable financial and statistical production reports to assist the practice manager with budgeting and revenue management. These reports assist the practice manager in daily, weekly, monthly, and yearly financial reconciliations of billed charges, receipts, and adjustments. Reports should be generated and reviewed routinely by the practice manager for opportunities to improve the management of practice revenues and expenses, as well as billing, accounts receivable, and collections processes. So let's look at some of these reports. So the production by provider report shows how many patients were treated within a specified period of time by each provider in a practice, along with the revenue generated. These are important statistics to track over time and may be used for a variety of reasons, including the following. First, calculating provider salaries if based on the number of patients that they treat, or calculating the number of appointment slots needed for each provider, scheduling staff, ordering supplies. In Figure 9.12 is an example production by provider report illustrating the incoming revenue for each provider. This report reflects both month-to-date totals and year-to-date totals. In the first column, you see the ID number of the report provider. You see the ID number of the provider. The second column is the name of the provider. Then there are 3 columns for month-to-date totals and 3 columns for year-to-date totals. The first of these 3 columns of each section reflects the amount of charges generated. The second column reflects the amount paid. The third column reflects adjustments that were made to the patient's account. There are many reasons for adjustments, such as refunds or overpayments, differences between the amount billed and the allowed amount per the insurance contract, and non-payment by a patient. Right, then we have our calculate. We don't go through each one of these in the slides, just kind of look in there. So calculating provider salaries. If a provider salary at North Star Physicians is based partially or totally on how much revenue is produced by the provider, you would use the payments column to calculate the provider salary, since that is actual revenue that was received. Now, talking about using this report for slots and scheduling, an office manager is able to see at a glance which providers need the most appointment slots available for scheduling. So if you only have a physician that sees 2 or 3 patients a day, and you got a physician that sees 12 patients a day, well, you know which physician needs more slots. And then, using the same report, an office manager is able to see at a glance which providers need the most appointment slots and need the most medical assistance and staff available to assist them. So, not just physician appointments, but the staff that are going to assist the physician. You need to be able to schedule those as well. And then last, because the use of office supplies would also be expected to fluctuate with the amount of patient activity, an office manager is able to use this report to gauge supply use and ordering. All right, then we have the production by procedure report. It reflects the number of procedures performed during a specific time period along with associated revenue. You have our example in figure 9.13. This report lists the CPT code that was billed along with the description of the CPT code, the associated charge for the procedure, the number of procedures performed during the time period specified, the total amount billed, the expected payment amount to be received, the actual payment amount that was received, and the actual adjustment in the patient's account that needed to be made. Another useful data sort would be by actual payment amount. A data sort is arranging data in a particular sequence from high to low or low to high. All right, and again, look at those figures. You've got 914 and 915. Those two examples, they actually have them sorted. 14 is sorted by procedure, and figure 9.15 is sorted by actual amount. All right, moving on to our, let's see. We also have a another report here. It's not in our slides, so I was kind of checking for that. But it is a production by insurance report. This report reflects the amount of revenue generated by each insurance carrier. As you can see by example 9.16, Apollo Health has generated the most revenue for North Star Physicians year to date, with Cobalt Care generating the least. So you see you have different payers there. Those are the companies. And then you have payments, adjustments, charges, etc. All right, moving on to day sheets over on 255. Besides production reports, which may be generated for different time periods and focus, there are several other reports that are useful in practice management. One such report is a day sheet. A day sheet is a report of practice activity for a 24-hour period that is used to reconcile patient accounts on a daily basis to ensure that no fraud, abuse, or theft is occurring. To accomplish this daily reconciliation or balancing, the most common type of day sheet used is a patient day sheet. The format of the patient day sheet may vary, but usually contains the patient name, patient account number, description of the activity such as the charge, payment, or adjustment, the provider, transaction code, which could be your CPT code, your type of payment or reason for adjustment, amount, and inter-report totals. Two other day sheet reports that may be useful within a practice's daily activity reconciliation are the payment day sheet and the procedure day sheet. The payment day sheet is similar to the patient day sheet, except it only lists the payments made during the 24-hour period. Likewise, the procedure day sheet is similar to the patient day sheet, but it just lists the procedures charged during the 24-hour period. And you can see an example of a patient day sheet in figure 9.17 over on 256. All right, then we have deposit reports. Two types of deposit reports may be generated daily, weekly, monthly, and yearly for the deposits made from insurance payers and from patient payments. The reports reflect the totals for payments made in cash, checks, credit cards, and electronic direct deposit. The deposit report may be filtered by several categories as noted below. A filter limits the records that are included in the report. And so different filters could include payment date, which could be from and to, payer type, insurance or patient, payer, all insurance payers or patients, or specific insurance payer or patients, and then by provider, a specific provider or all providers. The patient ledger is a report that reflects the patient's financial status in a summary or in detail. Charges, ledger notes, billings, payments, and adjustments are all shown in both the summarized and detailed status. The status of each charge is listed, as well as insurance payments that have been made and the amount for which the patient or the guarantor is responsible. And you have a patient ledger in figure 9.19. Then we have a patient aging report. Patient aging report is an accounts receivable report that shows how long patients have owed money to the practice. A provider's practice may use this report to follow up with patients regarding payment for past due balances. This report is separated by the length of time outstanding, such as 15 days, 21 days, 30 days, 45 days, 60 days, over 90 days, or over 120 days. A typical report for aging is shown in figure 9.2 on page 258. Alright, so that brings us to the end of the chapter and the chapter summary. So healthcare service providers must have accurate insurance information to be able to accurately bill for their services. Health insurance is a type of insurance that pays for healthcare services that are incurred by the insured person. The discussion of national health insurance has been ongoing for many decades and includes the creation of Medicare and the Affordable Care Act. There are many third-party payers with which medical billers will work. These include government-sponsored plans including Medicare, Medicaid, TRICARE, CHAMP VA, and workers' compensation, private payers, and self-funded health plans. Patient insurance eligibility and coverage is verified to ensure accurate insurance information for billing. There are many detailed steps the billing staff must perform in the practice to ensure the accurate and timely payment for healthcare treatment and services. Most healthcare providers are required to electronically transmit claims to insurance payers. The practice billing system that is part of the EHR or the interfaces with the practice's EHR assist in billing and claims processing, as well as revenue cycle management. The electronic superbill is used by providers to document the treatment and procedures that are to be billed. Standard practice management reports must be generated and monitored routinely. Alright, so again, be sure to go through this entire chapter, read each section, study those figures. Definitely study figure 9.1, which is our revenue cycle management kind of life cycle. And then be familiar with your acronyms and initialisms. This will always come back to you later, especially when you're getting ready to study for the RHIT exam. Just knowing these, what they stand for, will be super helpful. So happy reading and happy studying.